In this recording, we'll discuss male anatomy. The testes or testicles are ovoid or oval shaped structures. They are located outside of the abdominopelvic cavity. They live in a sac-like structure that is composed of skin, smooth muscle, and connective tissues, specifically the tunica abugini. This structure is just more commonly known as the scrotum. Each of the testicles, or each testis, is internally divided into lobules, and there are quite a few. We've got 200 to 300 lobules per testicle. These contain highly coiled loops known as seminiferous tubules. This is where sperm production begins. The sperm travel from the seminiferous tubules into what is known as the ret testis before entering into the epididymis, as it will travel through the duct system. Within the testicles, we find interstitial cells, also known as Leydig cells. They're actually located in between the seminiferous tubules within the testicles, and their job is to secrete testosterone, which is required for proper sperm production. So this is what we are kind of referring to. We've got the oval or ovoid shaped testicle. Within each testicle, we have the seminiferous tubules, these coiled tubes. And you'll notice that all of these drain into the ret testis, which is this region, and then the sperm would next travel into, here we go, the epididymis. Epididymis. Oop, and then next we would move into the ductus deferens. Okay. In between, let's see our picture here. We can see little sperms are being created. And then we've got, here's our interstitial cells that are creating that testosterone. Okay. So it's kind of where we're at right now. We've got the scrotum, okay, which holds both testicles outside of the body. Okay. All right. Now, that duct system does begin with the epididymis, which, even though it's coiled, so if we uncoiled it, it would be about 20 foot long. Okay, which, I mean, that's pretty long. Okay, this is the site of sperm maturation and storage. Remember, we created the sperm in the seminiferous tubules, but they're not going to be fully mature sperm ready to make a baby yet. We've got to give them time to mature, and we're going to store them while they do that. It takes about 20 days for sperm to swim through the epididymis, and during that time they are going to grow, they're going to mature, they're going to finish developing their little tails. During ejaculation, the smooth muscle contractions will send the sperm into the next part of the tube, which we call the ductus deferens or the vas deferens. Okay, so the vas deferens begins where the epididymis stops, and this goes about 18 inches, okay, which is quite different than our 20 feet of epididymis. The tube travels with the testicular arteries, veins, and nerves. These are collectively wrapped in the spermatic cord, which is just connective tissue. These travel through the inguinal canal into the pelvic cavity. Okay, so remember, we're starting outside the abdominopelvic cavity, but we have to go into the abdominopelvic cavity as well. And that's how we get in there. This does pass over the urinary bladder, and we're going to terminate at a region known as the ampulla. Okay? As sperm moves through the vas deferens, the next stop will be the ejaculatory duct. By this point, they are mature sperm. They are ready to fertilize an egg if we provide them the opportunity. These mature sperm are stored in the urethra until ejaculation causes them to move forward through the next part of the tube during the peristaltic wave contractions. Now, it is very common for a male to undergo a vasectomy as a form of birth control, you would sever the vas deferens from the rest of the duct system. So the sperm are still produced, okay, but they're not able to progress farther than the vas deferens region. They'll just degenerate. Okay, it's easier to do this than try to remove the testicles because you would still need testosterone production as well for other things. Okay? So it's just easier to cut the tube. The blood vessels aren't cut, and so the hormones, the testosterone levels are not affected by this. It's just the sperm. Now, the next section is the ejaculatory duct. It is a whole 1 inch long, kind of short. It sits behind the bladder. It forms from the union of the vas deferens and the ducts of the seminal vesicles. Okay. We are going to transport sperm into the prostate, or like through the prostate, on the way to the urethra itself. And so this is, it's 1 inch. It's very short. It's really just a transport tube. And then we get into the urethra. Okay, so remember we're talking about male anatomy, so the urethra is about 8 inches long. It is both part of the urinary and the reproduction systems because we have both urine and semen traveling through the region, but not at the same time. There is a sphincter at the base of the bladder that prevents urination during ejaculation, so it's one at a time. Okay. We have 3 regions of the urethra. We've got the prostatic urethra, which is surrounded by the prostate gland. Then we have the membranous urethra, which passes through the external urethral sphincter, okay, which runs from the prostatic urethra to the penis. And then the last region, the spongy urethra, this runs through the length of the penis and terminates at the external urethral orifice. All right, so this part runs the entire length of the penis. So when ejaculation occurs, sperm will enter the prostatic urethra from the ejaculatory duct. Then that sphincter we mentioned at the bladder, it constricts, so no urine will pass into the urethra. So again, it's one at a time. You're either moving semen or you're moving urine. You're not doing both at the same time, which, let's be honest, that's good. All right, so this is what it all looks like. We've got, let's see, last time we left at the epididymis, so we're going to come up the vas deferens. Here is the ampulla that we mentioned. We've got the ejaculatory duct. Remember, that's just very short, and it's going to be where the vas deferens and the seminal vesicles dump fluids. Then we've got the prostatic urethra, which runs through the prostate. The membranous urethra is next. And then we've got that spongy urethra that runs the length of the penis. Okay? All right, so that just kind of gives us a visual of what we've been talking about.